or other advertisers.
This is ContactTalkRadio.com. Consciousness in action. And you are taking action into your consciousness by tuning into Contact Talk Radio.
And on TuneIn.com, Ping.fm, and UpSnap Mobile.
Contact Talk Radio. Welcome to What the Health, an independent approach to your health span. Have you noticed how our healthcare system may not have your best interest in mind? Join Dr. Eckel in this fun and sometimes disturbing exploration of the state of healthcare and what it means for you. Now, here's your host, Dr. Eckel.
Hey, welcome back, everybody. This is What the Health, and I'm Dr. Greg Eckel, and I have a great treat for you today. Dr. Amy B. Killen is in the house. She's an anti-aging and regenerative medicine specialist with a focus on skin and sexual health. And our topic today is riveting. It is sex and skin, what they say about your health and how to optimize them. So welcome aboard, Dr. Amy B. Killen.
Thank you. I'm so excited to be here.
Love it. I'm really psyched. We've been trying to get you on the show for quite some time now. Your schedule has allowed it today. The gods have spoken and we got you on here. I think you are one of the top leading experts in the country on these topics, and I'm really excited. You know, I've been following you on the Instagram, and I encourage folks to go out there and do that because you have really educational posts on health, right? And your background is you've kind of had a circuitous pathway here, right? So, you know, you were actually up here in my hood here of Portland, Oregon. You had a clinic 2 blocks away, even though we didn't even know each other here. But you were, you know, trained in conventional medicine. You were ER doctor, 7 years emergency room physician. And, yep. You know, you're top of the class in your at Southwestern School of Medicine in Utah.
School, yep.
Perfect.
Up in Dallas, yep.
Oh, in Dallas, yeah. And then you had a change of heart trajectory. What made you get into something else?
It was several different things. So first of all, I was in the ER for almost 10 years if you count training. So basically 10 years in a conventional sort of very busy emergency department. Towards the end of that, I had 3 kids of my own in 2 years. So I had twins, and then I had another baby 20 months later, and I had all these children, and then my husband moved out of state. And so basically I was kind of the lone caregiver for all these kids. And I was also working full time in the emergency department at a shift that started at 4 a.m. So I was having to get up at 3 a.m. So I was getting very little sleep, super stressed out, you know, drinking tons of Diet Coke and Monster energy drinks and eating garbage and never exercising. And just like, I was just kind of a beast of a person, like just not very happy. And this was going on. And so I realized that this was a problem. At the same time, I started seeing that a lot of my patients actually were kind of the same way. Like they were coming into the emergency room, not with actual emergencies, but to them it felt like it because they were so, you know, either depressed or anxious or strung out, or they, you know, super tired or just couldn't get through their day and things like that. So I started realizing that I wasn't able to help my patients with the skill set and the time that I had in the ER. And I also wasn't helping myself. So I kind of needed to do this sort of 360 and learn some new tools to help myself and ultimately my patients. And so I started studying this field of integrative and regenerative medicine. And I've been doing this now for 7 or 8 years, I think.
Awesome. Yeah. And I think you're training other physicians, like, and you're lecturing internationally at this point. And I mean, you're a big deal.
I'm not a big deal, but I do train other doctors. You know, what's interesting about this field is there's actually not a lot of, you know, you don't learn all of this kind of stuff in medical school, even, you know, whether it's naturopathic or traditional medicine. A lot of the emerging therapies that are out there are just not taught yet in the medical schools. But it takes, you know, they say it takes 17 years between when something becomes known and scientifically validated before it becomes standard of care in traditional medicine. So it's 17 years of doing something maybe the old way or the wrong way. So anyway, so there's a lot to be learned still.
Yeah, that's awesome. So our topic today, sex and skin and what they say about about your health and how to optimize them. So a lot of folks, and possibly myself included, don't really put sex and skin together in the same boat. So how did this topic come about?
So this came about because when I first started practicing integrative medicine, I was doing a lot of hormone balancing, nutrition, fitness, things like that. And patients would come to me initially with some kind of, overwhelming problem. They couldn't lose weight. They were fatigued. They had no motivation, just whatever it was. They'd have this problem. And we'd work for a few months to start to get to the bottom of that problem. And then when I'd see them again, maybe 6 months later or longer, they would say, okay, oh my gosh, my energy's so much better. Like, I'm losing weight. I'm feeling better. I'm exercising. And they say, but now can you please help me with either my sex or my skin? And so it was over and over again. People would ask me for help with one of these two things once they kind of established this foundation of health for themselves. And so I realized it was kind of like this next level health. Like, you have like your foundational health, which obviously it's very important to get your diet on right and to get chronic diseases controlled and to exercise and meditate and all those things. But if you've gotten that handled, then there's this sort of next level that we can look at to optimize things like skin, hair, sex, and some other parts of your life.
Lovely. Well, what is this concept of what is a sex portal and why is it important for our health?
So sex portal that's a name that I made up, but I think it sounds a little racier than it actually is. But basically, it's this way to access optimal health and wellness that relies on people coming in to see me or another doctor with what they believe to be a sex problem. But actually, as you dig deeper, it turns out it's not so much a sex problem as it is a health problem. But because they care about fixing that sex problem, because they care about their erections, about their sex lives, their whatever it is they have going on, we can actually use that fact that they care about that to teach them all the other things they could be doing for their health and wellness to make them healthier and happier overall. So that's the sex portal.
I love it. I love it. It's a great portal into really getting at underlying causes. I love it. Exactly. And it's super motivating for folks, right? So I'm guessing you're talking a lot about cardiovascular enhancement what is going on here? So we've got the sex portal. People are coming in, right? It's a major quality of life issue for a lot of folks, right? Because we can have really healthy, functional, fun sex through our 80s and 90s, yeah?
Yeah, totally. So I'll give you some examples of some patients that I have, types of patients. Obviously, I won't tell you actual patients, but patients that I've seen that have come to me with sort of sex problems that we end up sort of, figuring out something else that's going on that was pretty big. So certainly the cardiovascular. So, erectile dysfunction is huge. I see a lot of men with erectile dysfunction. They'll come in and say, can you do something about this one problem? And of course, as we dive in, we realize, that maybe they're overweight, they're pre-diabetic, they've got low testosterone, which of course it ties in directly with both the high blood sugar and with the obesity. And then they've also got some atherosclerosis. So they've got plaque in their blood vessels, which so they're going to be at increased risk for cardiovascular disease with heart attacks, strokes, all of those kind of things. So essentially their erectile dysfunction is not so much a penis problem. It really is a systemic problem. It's blood pressure, it's diabetes, it's obesity, it's cardiovascular disease. And as we fix, hopefully, or try to fix all those other things, then the penis part comes back online for a lot of these people.
Got it.
So that's an easier, kind of common thing that we see. But it could be it could be much more complex than that. I have, for instance, I've had female patients who come in with difficulties, sexual problems, problems with orgasming, problems with arousal, things like that. And they're, a lot of times, actually, I've had women tell me they think that their vagina is broken. Like, I have a broken vagina, and I'm like, really? I'm not sure that's broken. Let's talk about that. And it turns out that maybe it's not so much that they have any kind of genital problem. Maybe they have some kind of emotional problem going on. Maybe they have a spiritual problem where they've been taught that sex was bad their whole life, and they're still struggling with that and kind of in their spirituality, or they have social problems with their relationship. So basically it can be all of these. There's sort of 6 main sort of problems that can affect sex, and that's physical health problems, but it's also social problems, so relationships, it's emotional problems like depression or anxiety, it's mental concerns. It can be also environmental problems, toxins, exposures, things like that. So there's really a number of things that can affect whether or not we are healthy sexually.
So yeah, let's unpack those 6 main areas that you've uncovered or kind of put together package for patients, right? And the themes that you've seen over the years of, because you're seeing a ton of folks for this specific issue, right?
Yeah, I do. And this is one of the things that I focus on. I think that it's important to talk about these issues because I don't think enough of us do, especially for women. I mean, men are a little bit better at it, I think, because there are some, pills available and such that people know
Right.
about. But I think especially for women, people just don't talk about it as much as I would like for them to. So I want to sort of open the door for people to be able to talk about it with their doctors or their healthcare providers. But yeah, so the 6 things I look at, certainly physical health, and that's a big one. That could be anything from hormonal disruptions, both for men and women, lack of nitric oxide, which is really important because we lose that as we get older. Cardiovascular disease is a big one because if you don't have blood flow down to the organs in question, then you're not going to be getting the response that you want, whether you're a man or a woman. So those are some of the main things that we look at. Diabetes is another thing. From a physical standpoint, getting the body sort of physically in shape is really important. But then there are other things that maybe they're not my areas of expertise, but I at least will talk to patients about them and then give them the people to talk to. So again, it's things like the emotional health and depression, anxiety. We know that if you have bad self-confidence, if you're depressed or have anxiety or other sort of mental emotional issues, then you're more likely to have sexual dysfunction. And unfortunately, that sexual dysfunction then will feed back and make you more likely to be depressed and more likely to be anxious. So it's like this chicken and egg thing.
Yeah.
It just goes around in a circle. So that's a big one to get people involved in. And then, the environmental piece is really big, especially when we're talking about hormones and hormone disruptors and things like that. Just the toxins in the environment and the foods, things such as that can actually disrupt your ability to make testosterone or your ability to make, thyroid or other hormones that might be important for you to have on board. So that's another piece that is also really big. And then of course the social piece is about your relationship, which is not something that I can fix for you, but I can send you to somebody else that can, because if you're not in a good relationship and you're not happy, then all of the tricks and tips in the world are not going to help you have good sex.
Right. Yeah. If you don't like your partner.
Right. Exactly.
Yeah, that's things definitely that stops blood flow for sure.
It totally does.
With regards to, I guess on testing, like where do you start with folks? Like they come in and say my vagina's broken. Like where do you kind of go through each of those areas that you talked about? One, what do you like your lover or your partner?
Right.
Is a starting spot, but when you start getting into testing, are you looking at blood tests, or you do some of the other functional medicine tests, or do you have favorites that you've found that really correlate well, or can you just really get it from taking a good case in history?
It depends on the person. A lot of it really does come from the history. So a lot of what, if you listen to what, the story that they're telling you, quite a bit of it will actually come just from the history. And what I found is that a lot of people, like no one's listened to them. Even partners. I have so many men and women who come in, oftentimes separate from their partner, and I'll be talking to them. I usually will ask them, even if they don't volunteer necessarily, but I'll ask them about sexual function and health and things like that. And it may take a minute to get them going. They may be kind of embarrassed, but once they start talking, a lot of them, they've never spoken to anyone about it. They've never even talked to their sexual partner. Like I'll have men who have ED, who, they have erectile dysfunction. They know it. Their partner definitely knows it also, but they've never communicated about it. And so it's something that they just don't know how or don't want to, or they're embarrassed or whatever. But so that's a big part of it, just listening. But as far as test goes, I do a lot of different types of testing. I tend to do blood testing for most people in the beginning because it's covered by insurance, and my clinic does take insurance for a lot of that. And I think it's a good starting starting point. There's certain things certainly that in the blood you can get really good information on, like testosterone levels actually are pretty accurate in the blood, thyroid, things like that. So I'll start with that. And then if it's someone who's pretty complex or the blood is not helping, then we can go to like urine testing, like for other hormones, or even saliva testing sometimes.
Got it. Cool. And when you do a lot of bioidentical hormone treatment, And then how do you follow them with those? Through the blood again, or are you looking at metabolite testing or anything like that?
Yeah, I do a lot of bioidenticals. Again, most of my patients in my hormone practice are insurance patients. So they're actually, their insurance is paying. And because their insurance tends to not want to pay for urine metabolite testing and things like that, we don't often do those tests, although they're excellent tests. So I certainly in women who have, we're really having a hard time dialing in their estrogen levels and their progesterone, and we can't quite get the symptoms to balance with the levels. I think that some of the urine testing, like the Dutch tests and things like that, where you're getting so much more information than you are the blood, and you also can know if you're putting this person at more risk for developing cancers and things down the line, can be really helpful if you have a doctor who does those tests and if you're willing to pay for those tests.
Sure. Awesome. Now, okay, we talked about 6 main things. So we've got relationship, we got physical, we got environment. What other items are in there?
Sorry, then there was mental and emotional, which are actually 2 different things.
Okay.
What am I missing? Oh, and spiritual. Spiritual.
Oh, and spiritual.
So,
awesome.
Yeah. Yep.
How do you bridge the gap on the spiritual component? Is that really around what you were talking about around maybe they had some negative connotations growing up around, sex is bad, whatever?
Yeah, that's a common thing that I see. It's certainly not the case. Everyone doesn't have that problem, but that's a common issue that I see as people have just grown up with these negative connotations about sex. But certainly there are other things, if people are having just any other spiritual concerns, if they're kind of floating around and feeling like they don't have a purpose, and there's all of these things can play into sexuality. And certainly we know that in a lot of the Eastern practices, the sexual practices rely heavily on the spiritual, and they don't believe that you can advance sexually if you're not advancing spiritually. So I'm not an expert at that, but that's certainly something that is very prevalent.
Got it. Yeah. That seems to be that's a big component, because it's been divorced out of medicine, talking about spiritual component to life and health. And it seems like it's making more inroads, I think, appropriately, because we are heart-centered dynamic beings moving through time and space, right?
Right.
That's how I talk about it.
I know. And I love that. I think I have like some little like love cards from you that have these cute little sayings on there. That's something that reminds me of that.
Excellent. I'm doing my job. So with the, so what other facets? So like you're doing some really innovative stuff. So I wanted to talk to you about, there's the bigger picture of, on the physical and spiritual plane and environmental. What have you seen on the environmental front? Actually, let's start there on maybe some case stories around you saw some environmental aspect for one of your patients.
Most of those patients, and again, because of some of the limitations in my practice with taking insurance, we can't always do all the tests that we'd want to. But the biggest thing I see is men with low testosterone who we don't necessarily know what's causing it, but we've ruled out some of the main causes. They're not obese, they're not sedentary, they're not over the age of 40, they're not they're all the things that we kind of look at that are contributors to low testosterone. Once we've ruled a lot of those out, one of the things that I think about at least is potential toxin exposure, and that could be it could be in the water bottles you're drinking, it could be in the food you're microwaving. It literally could be coming from anywhere. So it doesn't mean I'm not at their house like going through their house to see like what it is that they've got going on, but I at least sort of talk to them about what some of these issues are, and maybe trying to eat organic foods and not drink out of plastic bottles and not microwave plastic, and some of the things that we know can be harmful to our hormone systems. I try to have them avoid those things. Awesome.
What's your take on it? The labs recently dropped the total testosterone range by like 300 to 400 points. So really accommodating the castration of men in our society.
Yeah, we know that in the last 50 years, the total, the mean testosterone level for the population at large has gone down significantly, like you're alluding to, and the lab has adjusted their reference range, because the reference range is looking at that 95, of the population. Like this is where are most people in the population? They sort of have this bell-shaped curve, and that's where they want to keep those lab reference ranges in keeping with the population. So just as our weight has gone up, and the mean, overall weight for the in the U.S. has gone up quite a bit, testosterone levels have gone down, and I think that's a big problem. It's a big problem because we have lower sperm counts, much more infertility than we used to have, and then you have men who just feel miserable because they've got low testosterone. And I'm a doctor who does give out testosterone to appropriate patients, and I've had people say, well, you shouldn't be giving testosterone to people because that's just a made up diagnosis. Like everyone's getting that diagnosis now, and not everyone's getting it, but a lot of people are because they actually have low testosterone.
Right.
So I think it's a big problem, and certainly there are a lot of things that men can do on their own without taking testosterone that can be beneficial. And I always start there. So I always start with lifestyle. So things like, exercising, both weightlifting and resistance training, as well as cardio exercise can increase testosterone. Making sure you're getting enough protein and branched chain amino acids is important, and vitamin D. There's actually studies that show that if you just go outside for 10 minutes every few days and get some sunlight, you can increase your testosterone. So that's easy and cheap. Or free, actually.
Yeah.
So there's some things like that. Sleeping is really important for making all of your hormones, including testosterone and growth hormone and some of those things. And most of us don't get enough sleep. So we start with the basics. But if we've gone through all the basics and people still have really low levels, then we talk about therapy after that.
So I love that you start with the basics, and I really appreciate you bringing that up, because it is really, a lot of folks don't start with that and they get right into these therapeutics. Of course, they're more sexy to talk about the therapeutics, so I want to talk about those. But those foundations are really important too. So what are the next steps for folks? And we're going to talk about women as well, but on the, let's say, men front, just since we started on the testosterone discussion, what you're doing the PRP and the P shot, and you're doing the O shot for women. So help just introduce my listeners and viewers to some of these therapies, because they might not be aware of them. It's common knowledge to you and I and folks in our circle, but this is like newer medicine for a lot of folks.
Yeah, so we have, obviously you want to work on the basics, work on testosterone, but some of the therapies that we have that fall under this regenerative medicine category. Regenerative to me just basically means using therapies that are allowing your body to heal itself. So you have the tools already, you already have all the things you need to heal yourself, a lot of those things are turned off or turned down. So we're using some therapies to try to activate those processes. So platelet-rich plasma is one of the go-to therapies that I use. And this has been around for 30+ years. It's very commonly used in musculoskeletal arthritic pain, like knee pain, shoulder pain, things like that. But basically, we take your blood from the patient and we just centrifuge it, so spin it, so that we can concentrate the platelets, so that you get a bunch of platelets and a little bit of serum. So just a bunch of platelets, and those platelets are actually very strong. They have a bunch of growth factors in there, and they're responsible for a lot of the signaling that tells your body to repair itself. Just in general, that's what your platelets do. So like if you cut your arm, for instance, you have an injury, you cut your arm, you bleed, the platelets come on the scene, they stop the bleeding, and that's great. But they also send out all these growth factors to all the cells around them and say, hey, we've got this injury. Like, let's get some collagen in here. Let's get some more blood flow in here. Like, what are you guys doing? Stop sitting around. And so they kind of direct that healing process. So we take advantage of those platelets and we make this platelet-rich plasma, which we can then inject into different areas. So I use it like I use it everywhere. I use it for the sexual injections. I'm doing injections of platelet-rich plasma into the penis directly after we numb it. So it's not actually a painful thing. That's called the P shot, is kind of the common name for it. And then we have similar injections for the woman called the O shot, where we're injecting into the vaginal tissue as well as the clitoris. And then as we can kind of step those procedures up and even add other things to it, like stem cell growth factors or stem cells or exosomes or other pieces. But the most important thing to remember is that all you're really doing is communicating with some of these growth factors and platelets to try to get your own body to start to heal itself.
Lovely. Yeah. That's a great, I love that concept. And really, so this information is just coming in as cell signaling to help the body heal itself.
Right, you've got these stem cells, and you probably heard about stem cells. I know obviously you have, but stem cells are the cells all over your body that are responsible for the upkeep of whatever that organ or tissue is. So as your liver gets damaged, the stem cells can reproduce. They can make more of themselves. They can kind of keep your liver healthy. That's true in the skin, the heart, the brain, like basically everywhere. But as you get older, those stem cells, they become less active. So even though you still have them in all parts of your body, they're just not doing the work they used to do. So what we're trying to do with the sexual injections, as well as I use these same kind of things on skin and on hair, what we're trying to do is just communicate with your stem cells that are already in your tissue, that are already there, to stop being so lazy. Like, let's start getting some blood flow in here. Let's start making some collagen. Let's get this tissue to be a little bit more youthful looking and acting.
Interesting. So so I guess that comes up to this skin and sex overlap in terms of both prevention and treatment. So what's the link there?
So the link actually is, if you start to look at the different things that cause problems with skin, and the things that can cause problem with sexual function, there's actually quite a bit of overlap, and a lot of it's lifestyle, a lot of it's diet and exercise and mind medicine and things like that. But then there are also a lot of overlap in the treatment. So things like platelet-rich plasma and sort of stem cell therapies we can use for skin and sex, things like lasers and radio frequency, which are going to be tightening kind of modalities we can use for both. Things like the shockwave therapy, which I use to treat men with erectile dysfunction very commonly. It's great. You can use that for skin as well. So there are so many overlaps in the way that we treat skin and sex that I just kind of put them together into one category. Skin and
Love
sex.
it. Awesome. Really, I think it's great. And so all of those therapies, right, you're seeing that benefit in your clinics on just helping people with their skin sex. I like it.
With their skin sex and hormones, which we touched on briefly. But like, for instance, estrogen, after a woman goes through menopause, estrogen levels go way down. And estrogen is like the key hormone for both skin and sex. It does all kinds of things in your body, but it's really important for keeping your skin, your collagen structure, keeping that where it is. And when women, after they go through menopause, two of the big things they notice is that their skin becomes, it ages a lot faster. They start to have, sagging of skin, thinning of the skin on their face. And then they also have all of these similar kinds of changes in their vagina. So they've got thinning of their vaginal tissues, sex becomes painful. And all of this is estrogen related. So a lot of the hormonal regulatory aspects are also very similar from skin, between skin and sex. Sexy skin, skinny sex,
sexy skin.
all those things.
Yeah, they're just fun words to say together too. So with, but in particular, so why are women more hit with the kind of the thinning of the skin, or losing some of the tensality in the cheeks and in the face because of the estrogen component solely?
It's not just the estrogen. Certainly for everyone, everyone's affected by other things like the sun and the photo damage and things like
Sure.
that. But estrogen is more important for women's skin than testosterone is for men's skin. And I'm not sure why, but it's just something that's been shown over and over again that if you take that away, that it can be problematic.
Interesting. And what there's cautions clearly for women that might be thinking about this. A lot of women, basically after some of the trials just are like adamant, like, I don't want hormones at all. How do you counsel them to think about, like, well, maybe you want to consider this because your quality of life is going to go through the roof?
Yeah, absolutely. Yeah, I mean, certainly hormones are not going to be for everyone, although something like a vaginal estrogen is pretty safe for almost anyone. But there are some women who can't do hormones. Most commonly are breast cancer patients or people who are, within a few years of breast cancer. But there are actually there's estrogen as well as progesterone and testosterone receptors all over a woman's body. I mean, they're in the brain, they're in the bones, skin, vagina, heart, blood vessels, like they're everywhere. And so after menopause, when you lose all of those hormones, not completely, but pretty close, there's all these things that happen that can really be to some degree halted, at least, if you are able to continue to take some of those hormones. So like osteoporosis is a good example. The people that a lot of the OBGYN groups and things don't recommend giving estrogen just to prevent osteoporosis, but estrogen is probably the best thing that we have for most people, for most women, to decrease bone loss. And so if you can stay on estrogen and you can prevent some of that bone loss that happens after menopause, then maybe you're preventing hip fractures, which we know have a really high mortality rate associated with them. So even just osteoporosis is one. There's benefits in the brain, benefits to decreasing dementia. There's benefits to the heart and cardiovascular system, decreasing heart attacks, strokes, things like that. And then you get into the genitourinary system for women. When you lose your estrogen, all of a sudden your vaginal tissues get thin out. You have receptors in your bladder, your cervix, your vagina, like everywhere, and all those tissues suffer if you don't have estrogen. And so all of a sudden you're having urinary leakage, and you can't make it to the bathroom in time, and you've got prolapse, and sex hurts, and it's like a whole thing.
Yeah.
So certainly I think it's beneficial to talk to your doctor about bioidentical hormone replacements. It's not everyone wants it, not everyone needs it, not everyone can have it, but it can be really helpful for a lot of people, and that's men as well, men and women.
So on the women front, so we talked about kind of testosterone for men and then kind of next step. So for women, some of these things you had, pregnancy and birth, and then you've got laxity of tissue, you got, urinary leakage and prolapses. So, that definitely gets in the way of sex. And so what are the next steps for women after you deal with the foundational stuff?
So after you deal with the hormones and you get that kind of where you want them, then there's like the PRP, like I said, is an option, doing some injections like that. And then there are a number of other in-office vaginal therapies that you can do. So for instance, there are vaginal lasers that are kind of like a CO2 laser for your face, but it's in your vagina. There are several of those. There are also radiofrequency devices that basically use heat, but not to the same degree that lasers do, that are going to be essentially increasing your collagen production in the vagina. And you can do these treatments, usually it's between 1 and 3 treatments in your doctor's office. So there are several different devices like that. And then I also have a number of different home devices that I send my patients home with. And these are things that you don't have to have a doctor's prescription for in some cases, but things that you can use to help to strengthen the pelvic floor. So there are devices that are kind of like TENS units. You know what the TENS units that like where you put on your muscles and it makes your muscle contract, and it kind of is a little bit like crazy. So they have intravaginal devices that are essentially TENS units for your pelvic floor muscles, like the Intensity device. Intensity or Apex are 2 devices that do that really help strengthen those muscles. It's like Kegels, but like on steroids. Or we can use red light therapy, which is like a gentle red, warm light in the form of an intravaginal device, like with a VFit Plus device, which basically you just put this red light therapy in and you hang out for 12 minutes, and it's super chill and it's super relaxing. And you do that a few times a week, and that can actually make a difference as well for things like stress urinary incontinence, which is like when you leak, when you sneeze, or have jump on a trampoline, laugh, like anything. You have urine leakage, which is super very super common, and they can also help with sexual concerns as well. So there's actually quite a few tools out there that I think a lot of women don't even know about.
For sure. And that one, how long for like urinary incontinence? How long is a treatment plan for them with regards to that? I mean, I'm sure it varies for each person individually, but on average.
It depends on the person. And certainly we're talking mostly about mild to moderate incontinence. So like if you have severe urinary incontinence, then that may be a surgical, matter.
Sure.
But if it's mild to moderate, then it could be treated with some of these things. It's usually going to be about 3 months or so, depending on what kind of therapies you're using. But some of the lasers you have to do 3 treatments a month apart. Some of the lasers you just do 1 treatment, but you got to wait 3 months for effects. So it's going to be over the course of several months before you see benefit. And same thing with the home devices. Usually you're going to be using them for 2 to 3 months before you start to see benefit. But the point is, if you've had this for years and now you don't go for a run anymore, or you don't do CrossFit, or you don't, you're afraid to laugh because you don't want to pee on yourself, then maybe it's worth it.
Totally. I think it's pretty amazing. We live in an amazing time, and to have some of these devices coming online where I know you've educated me about some of those for my patient base. So it's been, you're having a huge impact here in Portland so thank you. And my patients, thank you for, urinary incontinence. This is stress incontinence. These are huge things that are really, really super common. I find a lot of my patients, they don't like to talk about it. It's embarrassing. It's like, well, but we could help you with these things, right?
Yeah. Yeah. I think as women, we've for so many years just kind of learned to grin and bear it, whatever it is. You're not happy with your sexual function, grin and bear it. You're not having a good time, grin and bear it. You're peeing on yourself when you go for a run, grin and bear it. I feel like because we haven't had a lot of options available, and because there's been, a different sort of culture around women's sexual health and sexual organs and all of that than there has been with men in some regards. I think that we've approached it a little differently, and it's finally time for everyone to know, we actually can improve a lot of these things in both men and women. You just got to ask for help and go to the right person.
Awesome. All right, I'm going to take a quick station break. This is What the Health, and I'm Dr. Greg Eckel, and my esteemed colleague and guest is Dr. Amy Killen. And we are talking about sex and the skin, not Sex in the City, but sex and the skin. And, if you're just tuning in, please go to naturecuresclinic.com/podcast and subscribe to the podcast. And if you're listening and you like the show, please share it with your friends and family. That's why I created What the Health. You're getting front edge information here from Dr. Killen. These are newer devices. It's not like, they've been around for maybe a few years, but it's just not common knowledge. And these conversations are really important for quality of life. And really, it hits my agenda of creating more love in the world where people don't have these issues, so that they're more present with their partners and their lovers, and that spreads through our communities, and that's the community that I want to live in, right? So that, there's more love. So that is What the Health. That's the premise of my show. So please share it with your friends and family. We love you. I am excited now. I want to change gears a little bit and see, because you are traveling and you're doing documentaries and you're treating a lot of people. Where do you see the industry going? What do you see innovations coming down the pike, or maybe exosomes or peptides? What are you seeing with these therapies in your practice?
Oh, there's so many things that are hopefully coming.
Yeah.
And certainly different countries in the world all have different regulations around some of this. A lot of the stem cells and regenerative medicine field is a huge one. Everywhere you go, people are talking about stem cells. Not everyone's allowed to do them, and there's a lot of gray sort of regulatory gray zones around that. But it's something that I think that we'll see that stem cells and exosomes are changing how we treat disease in general, not just the things that I'm treating, not just the sexual function and the skin and the hair, but really so many other diseases that are out there that don't actually have good treatments and certainly not cures right now. I think in the coming years, we'll see that we're using these kind of therapies for that. So it's a pretty exciting time to be alive, I think.
I'm in total agreement with that. So you have done, maybe speak to that, because you're doing some really interesting traveling around regenerative stem cell therapies. What have you seen in other countries that you're just like, oh my gosh, I can't believe they're doing that?
I was in India a few months ago, I guess last year, and I went to some of the clinics there and spoke to some of the researchers and doctors in India. They have a little bit different, a little bit looser rules regarding some of the stem cell therapy. So they're doing, lots of IV stem cell therapies from using the patient's own cells or even using umbilical cord stem cells for all kinds of things. I'm talking about from treating paralysis and spinal cord injury to diabetes to multiple sclerosis. There's been quite a bit of work in the autoimmune disease space that stem cells and these regenerative therapies seem to work really well for a lot of the autoimmune diseases like multiple sclerosis and arthritis of different types and things like that. So in India, as well as in like Panama with Dr. Reardon, and some of the clinics down south of us are doing some just incredible work in those fields, and they're publishing papers, and so eventually, hopefully, we'll be able to use some of that in the U.S. as well.
Lovely. How about on exosome specific or peptides? Where do you see those getting used? Because I think you're also educating doctors on on peptides, I believe, or
on exosomes. Yeah. So exosomes are basically kind of like their messenger arm of a stem cell. So when you think about a stem cell, these cells that you already have, the way that they work, one of the ways they work is they actually release these little pockets of these little bubbles. I call them these little bubbles of information. They release these little tiny bubbles that have in them all kinds of things, including growth factors and RNA and some other things. And then those little bubbles float around, and then they get taken up by the cells around them, and that changes how those cells behave. So for instance, the exosomes from stem cells, they get released, and they might go in, and your skin cells may take those exosomes up, and it may change the way those skin cells are making collagen or the way they're making elastin. So it can actually make those cells behave differently. So exosomes are a little different than stem cells, but they're at the same kind of family. And so I've been using exosomes for about 3 years probably for a lot of my procedures. In addition to the platelet-rich plasma, I will also use exosomes in my injections because I seem to get better results with that. And you don't have to necessarily take the stem cells from the patient, but you can get these exosomes which come from healthy babies' umbilical cords or other sources depending on the company that you're using.
Awesome. And what do you use them specifically for? Like scar reduction, collagen production, along these lines?
Yeah. They're great. Exosomes seem to be really good for wound healing. That's a lot of the studies that are ongoing right now are looking at wound healing because they seem to really hasten how fast wounds heal and then give you a better cosmetic result later. So you don't have as much scar tissue. It looks more natural. It looks like regular skin. So certainly I use them for that purpose, but I also just use them for just sort of general skin rejuvenation, to help increase collagen and elastin and hyaluronic acid to help your skin look more youthful, more plump, things like that. And those can be delivered with something as easy as like microneedling, which is, it's super easy to do. It's basically a device that just goes in about, up to 2 millimeters. You can treat a whole face in 10, 20 minutes and basically deliver those exosomes topically. So you don't have to do a lot of injections and you can get those into the area, all different parts of your skin because they're tiny and they just kind of diffuse right in. So it's pretty cool.
That is awesome. How about on the peptide front? Because I know we've had some conversations off air around the peptides, and they're kind of like the flavor of the month right now in integrative care. So, where do you see those fitting into continuum of care in your practice?
So peptides, I've just started learning about peptides in the last probably 6 months or so. And you're right, there's so many of them. It's a little bit overwhelming, even as someone who loves to learn. I'm just like, oh my gosh, there's so much. But basically, peptides are just small proteins, right? So they're just little proteins. Usually the ones that are sold by pharmacies are very similar to, if not identical to, the proteins that are in your body already. That they found these, little proteins and these peptides in different parts of your body doing different things, and they found a way to manufacture those peptides, and then you can give yourself shots, or you could do pills, or different ways to take them, but essentially trying to increase that protein activity in a very specific way. So some of the most common ones that I've had some experience with is like VPC 157, which is a very commonly used to increase healing of like musculoskeletal pain. So like tendons, bones, ligaments, things like that. It's actually a peptide that's made in the stomach or the gut somewhere. But it's been shown that if you can, if you increase those levels, at least in animals and probably in humans, that you may heal faster from injuries and things. And those are, they seem to be pretty safe. I've also been experimenting with a couple of different peptides for skin and hair. There's a topical hair peptides that you can apply to your scalp to help increase hair growth that seem to work better than like minoxidil and some of those products. And then there's even one of the sexual peptides, which is PT141, actually just got FDA approved as bremelanotide for a drug that's going to be helping women with low sexual desire, and actually works in the brain. But it's been used as a peptide sort of outside the pharmaceutical industry for a little while. But now it's getting FDA, it's gotten FDA approved, and now it'll be marketed, by big pharma and such as well. So there's a ton out there, and I don't know enough about all of them, but I think it's something that's interesting to follow, at least the ones that end up, kind of passing the early tests with the population.
Yeah, totally. And what about like other devices in like virtual reality, or you seeing anything around that way? I mean, does that come into your practice at all?
It doesn't come into my practice, but I go to the Exponential Medicine conference pretty often, and where they basically are showing you all these new emerging tools, things like virtual reality, or augmented reality, and how those kinds of things are being used. I mean, everywhere, from the operating rooms to showing patients, what the inside of their body looks like just by putting on some crazy glasses and showing them a screen. So I mean, the teaching possibilities with this kind of thing and these instruments is amazing. I haven't used it very much, but there's so many new modalities coming down the pipeline. I think this is the time in medicine more than any other where we're really seeing this exponential growth in the things that we can do, because all of a sudden you have all these fields coming together, like the biology fields and the technology fields and the nanotech and the AI and the this and the that and all the letters, and they all come together. They're all coming together in medicine, really for the first time, and no one's really quite sure what to do with all of it.
Yeah, right.
But there are some pretty exciting things that we'll be seeing in the next 5 years or so in that regard.
Love it. Well, let's see. So coming down the home stretch here, we got about 10 to 12 minutes. I'm wondering if there's any pearls or wisdom that you would like to share with the listeners of What the Health with regards to skin and sex and health.
Sure. So one of the things I love to share, because it's fun and not everyone knows about it, is I like to talk about nitric oxide and how important it is for skin and sex. But I'll talk about it mostly for sex. Nitric oxide is the main chemical messenger that tells your blood vessels to vasodilate, which means open up. So you have small blood vessels and they get a little bit bigger so that you can bring more blood into an area. This is a messenger that's all over your body all the time. And it's really important, as you might imagine, for sexual function. So when you have an erection, the main sort of stimulus for that, after your brain thinks about it, is that you have nitric oxide release, in and around the penis, and you have the blood vessels open up so the blood can rush in, and then it can stay there. And this is all signaled through nitric oxide. In fact, medications like Viagra work by keeping your own nitric oxide around longer. However, a lot of people don't have enough nitric oxide to begin with. Those medications don't work very well. And so what happens is after the age of 35 or 40, your levels that you're able to produce inside your own body start to go down precipitously. So when you're 40 years old, you have about half as much nitric oxide as you did when you were 20 years old, and that just gets worse and worse as you get older. So this is a huge problem. This is one of the common causes of sexual dysfunction in both men and women. So as we get older, as we get after we're 40, 45, especially if we're unhealthy, we're not able to make nitric oxide in our blood vessels like we used to be able to. So we have to rely on getting it from other sources like our diet. So you can actually eat foods that are high in nitrates. These are things like green leafy vegetables, spinach, arugula, kale, beets are very high in nitrates, even like dark chocolate, pomegranate, all of these foods, you eat them, and then there's two things that happen in your body that convert the nitrates into nitric oxide. So stick with me here. I know there's a little bit of chemistry involved, but you eat the food, you chew them up. The first thing that happens is that you have bacteria in your mouth that reduce the nitrates to nitrite, which so essentially you have bacteria that are good bacteria that are supposed to be there that begin the first process of being able to turn the food you eat into nitric oxide. But guess what you do, or you may do, or your listeners may do, that are killing those bacteria?
Oh, what?
If you're using any kind of antiseptic mouthwash, like Listerine,
yes,
which I think it's like 60 million Americans or something use antiseptic mouthwash on the regular.
Yeah.
If you're doing that, you're killing those good bacteria in your mouth, and you're not physically capable of making nitric oxide from food because you have just done that to yourself. So that's a big deal.
That is.
Along the same lines, people who use mouthwash, again, antiseptic mouthwashes like Listerine, they also have been shown to have higher blood pressures and increased risk of diabetes, also tied to not enough nitric oxide.
Wow.
So my first tip is, if you're going to use mouthwash, use it sparingly. Don't use it every day. And even better is to do some sort of do-it-yourself mouthwash, maybe where you don't have the alcohols and the things that are actually going to kill the bacteria. Right. You can just put a mint in, chew some gum, or just brush your teeth. That's a good tip also. So that's the first one. The second step actually happens in your stomach. So the first thing is in your mouth, second step is in your stomach. And one of the things that we see commonly is that people who are taking acid blocking medications, like the PPIs, which are like, Pepcid and omeprazole and things like that, or even like Zantac or over-the-counter, Pepcid and such, they can all change the acidity of the stomach, so you don't have as much acid in your stomach, and you actually need the acid to complete that second step in making nitrates into nitric oxide. So if you're using mouthwash and you're taking an acid blocker, then there's very little chance that you are making enough nitric oxide, and that can contribute to problems with sexual function as well as many other things.
Holy cow. Well, that's, yeah.
That was a knowledge bomb that I just spewed all over you.
I loved it. Nice. Very, very good. So on that front, what are other symptoms of lack of nitric oxide? So this is for men and women, erectile dysfunction for both, really.
Yep.
And a lot of people don't really think about women having erectile dysfunction.
We do. And in fact, in my Instagram feed just today, I put a story up about how women have just as much, we have erections, we have nocturnal erections, just like men do. Like we're very similar in a lot of ways.
Yeah.
But yeah, there are other things that you may notice instead. Like you may have high blood pressure. You may have high triglycerides. You may have poor gym performance. They can all be caused from lack of nitric oxide. Nitric oxide is also important for your skin. So if you it's one of the many causes of skin aging is lack of nitric oxide. So there's actually, nitric oxide does hundreds of things in your body, but it's really important that you are keeping your levels up. Exercising will help also, sunlight, red light therapy, all of these things can also help keep your levels high enough, but diet is also super important.
I love that one of your main messages on my podcast was eat your vegetables. So thank you.
And I have to admit, I don't eat nearly enough vegetables myself. So I could preach it, but I may not be the perfect person to do so.
No, and it is, honestly, me too. I get to tell patients every day, eat your vegetables. And it's like one of the main messages that I need to hear and actually do.
Yeah.
So it is, it's an easy response, of course, coming from the naturopath on the show, but, it is a big deal, right? For this nitric oxide, for the microbiome across the board, right? So that is phenomenal. So the mouthwashes, and basically using antiseptics for our mouths decrease nitric oxide production.
Yep.
And nitric oxide's production is decreased as we age.
Right.
So let's just do away with mouthwash.
Yeah, I mean, I think do away with it unless, occasional here and there is not going to be a big deal. But it's like antibiotics. Antibiotics kill all of the good organisms and bugs and bacteria that are in your body, and then you got to repopulate, and it's not good. So same thing happens in your mouth if you kill all those bacteria.
Yeah. Wow, that was awesome. Thank you for sharing that on the show. Again, everybody, What the Health? We are here on Tuesdays from 2 to 3. This is the information we're bringing at you this year and next. I really want to thank you, Dr. Amy B. Killen, for coming on. It has been a pleasure. And your information is awesome. I've got your link in the show notes for people to follow you. I'm going to also get your Instagram feed up there because it is, I would recommend folks to follow her because she is just full of those knowledge bombs, and she can spew that on your Instagram feed. Nice
Awesome.
language, Doc.
Thank you.
So again, any last parting words?
No, that's amazing. Yeah. Dr. Amy B. Killen is my Instagram, so come find me there. But I'm always looking for new stuff to learn, and then I love my patients, and they teach me things every day. So thank you so much for having me on your show.
Indeed. All right. Thanks.